Hi, my name is MKarshner, and I'm going to be doing my final health assessment checkoffs. I'm going to do a quick scan of the room. There's my table with my supplies. There's my patient. Okay. Okay, so hello, my name is Morgan. I'm going to be your nurse today. I'm going to be doing a head to toe assessment on you. Is that all right? Okay, I'm going to do some hand hygiene. I'm going to shut the door for privacy. Okay, can you tell me your name and date of birth?
Olivia Steele, April 3rd, 1998.
Okay, and do you know where you're at right now?
I'm at the clinic.
Okay, and what month is it?
November.
Okay, and what is your age?
23.
Okay, patient's age is consistent with her appearance. She is alert and oriented times 3. The patient is sitting upright. Her extremities appear symmetric. She does not appear to be in any distress. She is not making any involuntary movements. She is dressed appropriately for the weather and appropriately for this exam. There does not appear to be any deformities. The patient is making eye contact with me, and her behavior and her facial expression are consistent with the environment in this situation. And she does not appear malnourished, and she is well groomed. And I'm going to go ahead and get started with the exam. Okay, so I'm going to start with the patient's skin. Her skin is appropriate for her ethnicity. It is even throughout her body. There does not appear to be any hyper or hypopigmentation. I'm going to feel your skin. The patient's skin is warm and dry. There does not appear to be any lesions or deformities. The patient's body hair is appropriate for her sex. I'm going to test your skin for turgor. Okay, the skin is mobile and there does not appear to be any tinting. The patient's skin is also appropriate thickness for her age. Can I look at your fingernails? Okay. The patient's fingernails are pink and appropriately shaped. There are not any lesions. There does not appear to be any biting, clubbing, or spooning. I'm going to test the capillary refill. Okay, the capillary refill in the right hand is less than 2 seconds. The capillary refill in the left hand is less than 2 seconds. Now I'm going to move on to face. Can you please smile for me? Can you frown? Can you furrow your brows? And the patient's facial expressions are symmetric, which means cranial nerve 7 is intact. So now I'm going to move on to the eyes. The patient's eyebrows are symmetrical and there does not appear to be any hair loss. There's not any scaling or redness. Her eyelids, there does not appear to be any edema, and the color of the eyelids is symmetric with the rest of the skin on her face. Her eyelashes are evenly distributed. There does not appear to be any hair loss. Her top eyelids curl up and outward, and her bottom eyelids curl out and downward. The patient's sclera is white and clear. Can you pull down your lower lids for me? The patient's conjunctiva is pink and clear, and the patient's cornea, I'm going to test with the light. Just going to look at your cornea. Okay, there are no opacities in your cornea. Okay, and now I'm going to do I'm going to test your pupils. So I'm going to turn the lights off. Okay, so now I'm just going to have you look straight ahead and I'm going to shine this light into your eyes. Okay, the patient's pupils are 2 to 6 millimeters in size. They are both round and bilateral. They have a bilateral consensual response to light. The patient's irises are round and symmetric bilaterally. Okay, now I'm going to do the 6 cardinal fields of gaze test. I'm just going to make a letter H with my finger. I just want you to follow my finger with your eyes, don't move your head. Okay? So, okay, the patient's 6 fields of gaze are intact bilaterally, and this means that cranial nerves 3, 4, and 6 are intact. Okay, and now I'm going to do the peripheral vision test. I'm going to put my hands behind your head and I'm going to wiggle my fingers. Just let me know when you can see my fingers, okay?
Can see them?
Okay.
Can see them? Can see them?
Okay. The patient's peripheral vision is intact bilaterally. Now I'm going to do the near vision test. This test, I want you to hold this card 14 centimeters in front of your face, and I want you to read the smallest line that you can.
4, 2, 6, 7, 3, 9.
Okay. The patient's vision in both eyes is 20/20. Now I want you to cover your left eye and read the smallest line that you can.
4, 2, 6, 7, 3, 9.
Okay, the patient's vision is 20/20 in the right eye, and I want you to cover the right eye and do the same thing with the left.
4, 2, 6, 7, 3, 9.
Okay, the patient's vision is 20/20 in the left eye, and this means that cranial nerve 2 is intact. Okay, now we're going to move on to the ears. The patient's ears are equal and symmetric on both sides. The top of the pinna aligns with the outer campus of the eye. There does not appear to be any lesions or discharge. The patient's ears are intact, and the patient's cranial nerve 8 is intact based on the ability to have a conversation with me. Okay, and now I'm going to move to the nose. The patient's nose is midline on the face. Both sides of the nose are equal. They're symmetric bilaterally. There does not appear to be any drainage or discharge. There are no lesions or edema on the nose. The patient can breathe out of both nostrils. Okay, and I'm going to move to the mouth. Oh, the patient's nose the color of the nose is also symmetric with the rest of her face, and there is a smooth texture. The patient's mouth is, her lips are pink, moist, and there is no cracking or lesions. Can you open your mouth for me? Okay, the patient's oral mucosa is pink, moist, and there are no lesions. The teeth are white with a slight yellow color, and there are no broken or missing teeth. The patient's gingiva is pink, moist, and there are no lesions. Using my pen light to look in the back of her mouth, the pharynx is pink, moist, and there are no lesions. The uvula is midline, it is pink, moist, with no lesions. The tonsils are not enlarged, they're symmetric bilaterally, they are pink, moist, with no lesions. Can you say ah for me?
Ah.
Okay. The patient being able to say ah and swallow means that cranial nerves 9 and 10 are intact. Okay. So now I'm going to look at your tongue. The tongue is symmetric on both sides. It is even, it has a rough texture, it is pink and moist. There do not appear to be any lesions. Can you move your tongue side to side and up and down for me? Okay. The patient is able to move the tongue in all directions, which means that cranial nerve 12 is intact. Okay, so moving on to the neck. The patient's neck is midline. Can I tilt your head up for me? Okay, the patient's trachea is midline, and the color of her neck is consistent with the rest of her body. There do not appear to be any masses or lumps on the neck. Okay, so moving on to the thorax and the lungs. I'm going to just count your respiratory rate for 30 seconds, so just breathe normally. Okay, the patient is breathing at 16 breaths per minute. Looking at her, or the breathing rate is even. Her chest is rising and falling symmetrically. She has an effortless breathing pattern, and it is a regular breathing pattern. Looking at the anterior thorax, it is flat. There are no lesions. The thorax is symmetric, and the muscle development is also symmetric. Bilaterally, I'm going to listen to your lungs now. So I'm gonna place my stethoscope on you, so just take deep breaths for me. Okay, the bronchial breath sounds are clear over the trachea. The bronchovestibular breath sounds are clear over the first and second intercostal space. Vestibular breath sounds are clear over the anterior thorax. So now I'm going to look at your posterior side. So I'm just going to have you turn for me. Thank you. Okay, so looking at her posterior side, her back is symmetric. There is even muscle development throughout. There is a slight 45 degree downward slope in line with her spine. So now I'm just going to listen to your breath sounds on your posterior thorax. Just take deep breaths for me. The bronchiovestibular breath sounds are clear over T4 medial to the scapula. Okay, the vestibular breath sounds are clear over the posterior peripheral fields. Alright, so now I'm going to move on to the cardiac portion. So looking at your chest, I do not see any obvious pulsations. The chest is rounded. I'm going to palpate your apical pulse, so I'm just going to have you lean forward and to the left. Okay, I'm going to feel your apical pulse. Okay, the patient's apical pulse is located in between the 5th and 6th intercostal space. Now I'm going to auscultate the apical pulse for 1 minute. Okay, the patient's apical pulse is 72 beats per minute and it has a regular rhythm. Okay, so now I am going to listen to your heartbeat. So I'm going to listen first with the diaphragm and then I'm going to listen with the valve. Okay, S2 is greater than S1 over the aortic and pulmonic. S1 and S2 are equal over ERBs. And then S1 is greater than S2 over the mitral and tricuspid. So now I'm going to listen with the diaphragm, or with the bell, sorry. No S3 or S4 sounds are heard over the aortic and pulmonic. There are no S3 or S4 sounds heard over ERBs. And no S3 or S4 sounds are heard over mitral or tricuspid. Okay, so now I'm going to assess your jugular veins. So I'm going to use my pin light. I would have my patient lay back at a 45-degree angle, and I'm going to have you tilt your head up and to the right, or to the left, sorry. Use my pin light. Alright, there's no jugular vein distension on the right side, and then I'll do the same thing. No jugular vein distension on the left side. Okay, so now I'm going to assess your carotid arteries. I'm going to do one at a time. Okay, both carotid arteries are 2+ bilaterally with a regular rhythm. I'm going to do your brachial pulses. Okay, the patient's brachial pulses are 2+ bilaterally with a regular rhythm. Do radial. The patient's radial pulses are 2+ bilaterally with a regular rhythm. I'm going to do your tibial. The patient's tibial pulses are 2+ bilaterally with a regular rhythm. I'm going to do your dorsalis pedis pulses. The patient's dorsalis pedis pulses are 2+ with a regular rhythm. Okay, so now we are going to move on to the abdomen. So I'm going to assess you into a lying position. Or not assist you into a lying position. Okay. So looking at the patient's abdomen, there's no visible peristalsis. The contour is rounded and the color of the abdomen is slightly paler than the rest of the body. So now I'm going to listen. I'm just going to listen to your bowel sounds in all 4 quadrants. The patient's bowel sounds are normal active in all 4 quadrants. Now I'm going to lightly palpate your abdomen. I'm going to press down about 1 centimeter. Let me know if there's any pain or tenderness. Is there any tenderness?
No.
Okay, there is no pain or tenderness felt in any of the 4 quadrants. The muscle tone is symmetric in all 4 quadrants. So now I'm going to do a deeper palpation. I'm going to press down about 4 centimeters. Let me know if there's any pain or tenderness. Okay, was there any pain or tenderness? Okay, no pain or tenderness felt in any of the 4 quadrants. There were no masses felt, and I did not feel an aortic pulsation. So now I'm going to have you sit up. Alright. So now we're going to move on to the musculoskeletal portion. So the patient's all 4 limbs are symmetric. There is symmetric muscle tone bilaterally. I'm going to have you hold your arms up like this, and I'm going to pull against you, so don't let me pull you. Okay, now I'm going to push you, don't let me push you. Okay, now I'm going to do the same with your legs. Okay, I'm going to push. Okay, The muscle strength is a 5 out of 5 in all 4 extremities. So now we're going to move on to the neuro portion. I have this cotton ball. I'm going to touch you on all 4 extremities with the cotton ball. Just let me know where you were touched. Okay, go ahead and shut your eyes. All right, the patient's light sensation is intact on all 4 extremities. So I'm going to do the sharp and dull sensation. So I'm just going to poke you. This is sharp and this is dull. I'm going to poke you on all 4 extremities again. Just let me know whether it was sharp or dull and where you got poked, okay? Just go ahead and close your eyes.
Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp.
Okay. The patient's sharp and dull sensation is intact in all 4 extremities. That concludes our exam. Thank you for letting me do that. Everything was great.